All right, so we left off talking about the thyroid gland. And we started out talking about the thyroid gland producing thyroid hormones, which we said are T3 and T4. We talked a little bit about that, right? We said that we have these thyroid follicles, where we've got the follicle cells and then the follicle cavity in the middle, and we utilize both the cell and the cavity to produce the thyroid hormones, T3 and T4. The cell makes thyroglobulin, right, a large protein, and the cell takes up a bunch of iodine, and it utilizes the thyroglobulin and the iodine to make a bunch of T3 and T4. We said that once the T3 and T4 are released, they travel almost entirely bound to proteins, right, transport proteins in the bloodstream, and then eventually they get to their target cell and they have some sort of an effect. So that's where we are right now, talking about the function of the thyroid hormones. Thyroid hormones are extremely versatile. Okay, they have effects on almost every cell in the body, and they actually have a lot of kind of varied effects. They can do a lot of different things depending on what cell they're binding to and where they're binding. The thyroid hormones enter into target cells, so they do not utilize second messengers. The hormone itself enters the target cell and it binds intracellularly. It can bind in the nucleus, it can bind to the mitochondria and affect ATP production, or it can bind in other places in the cytoplasm. So again, we have a lot of different effects. Overall though, when you look at thyroid hormones, T3 and T4, you're going to see that they have a calorogenic effect. Okay, calorogenic. This is stimulatory. Thyroid hormones tell cells to make more energy, okay, so make more ATP and consume more ATP. So it amps that cell up and overall increases the metabolism of our cells. So cells they're using oxygen, they're using glucose, they're making a bunch of ATP, they're burning that ATP, and it just completely amps them up. It's very stimulatory. Okay, we call that a calorogenic effect. That also happens to result in heat generation, okay, which makes sense, right? That the faster chemical reactions are going, the faster the body's metabolizing things and working, you generate more heat. So thyroid hormones are associated with heat generation in cells as well. Here we have all of the specific effects of thyroid hormones. Again, it kind of varies depending on what cells and what tissues we're looking at. But if you remember that thyroid hormones are stimulatory, you can kind of make sense of everything else, right? You can think, is this stimulatory or is this slowing something down? If it's slowing down, it's not the thyroid hormones. Okay, they're very stimulatory. So we said it elevates the rate of oxygen and glucose consumption. What do we use oxygen and glucose to make? ATP, right? So increases ATP production, right, or generation, and consumption, right? So we make a bunch of ATP, we're burning our nutrients, we're burning oxygen, we're making ATP, we're using that ATP to accelerate all of our different chemical reactions, right? A lot of chemical reactions take energy, remember. We have to input energy to make these things happen. So we have to make a bunch of ATP and then use that ATP to speed everything up. The thyroid hormones go to the heart and they increase heart rate and force of contraction. So your heart starts pumping faster and it starts contracting harder. Okay, that increases your cardiac output greatly. Remember, both of those things affect cardiac output, right? Heart rate times stroke volume. So you have a lot more blood pumping out through the body, and that results in a great increase in blood pressure. This is actually one of the major problems that we see with hyperthyroidism. Hyper is what? Too much or too little? Too much. So hyperthyroidism is too much thyroid hormone. If the thyroid hormone is telling your heart to beat faster and harder, and now you have too much thyroid hormone, you're telling your heart to beat too fast and too hard. And it causes a really severe high blood pressure or hypertension. So almost always when you see a patient being treated for hyperthyroidism, they're also being treated for high blood pressure. Like with a beta blocker typically, because that will decrease the heart rate and heart contraction. Okay, so you don't want to give them a medication that works on the vessels, because constriction is not the problem. The vessels aren't the problem here. It's the actual heart that's the problem. So you've got to give them medication that slows down and eases up the heart. Thyroid hormones increase sensitivity to sympathetic stimulation. So the sympathetic nervous system, is that a stimulatory thing or a resting thing? Stimulatory, right? And the thyroid hormones are stimulatory. So what this means is that if anything is occurring that would stimulate your sympathetic nervous system, we're going to have an exaggerated response to that. So nervousness, right? You know when you get kind of freaked out or nervous, how your heart starts pounding and it's this whole like stimulatory thing? Now that happens times 10. Exercise, scared, frightened, anything that would stimulate your sympathetic nervous system. Now instead of a normal rise in activity, you get a really big rise in activity. That's why, again, when we look at hyperthyroidism, we'll see that stuff like nervousness is often found in people with hyperthyroidism, because a little tiny increase now becomes a huge increase. And when your heart's pounding like crazy and you're dripping sweat, it is really hard to not start to get freaked out. Because we're utilizing so much oxygen to make ATP, the thyroid hormones also stimulate red blood cell formation, okay, because you figure if we're using a bunch of oxygen, we have to deliver a bunch of oxygen. So we want the red blood cells to do that. So it stimulates erythropoiesis, stimulates other endocrine tissues. Again, look what you see, stimulates, increases, elevates, right? All stimulatory functions. The thyroid hormones also accelerate the growth of things like bone, hair, nails, all of these skin, these really rapidly dividing cells are stimulated by thyroid hormones. And this might sound good, right? Like when we talk about hyperthyroidism, the hair will grow really fast. And you're like, this is awesome, right? I want hyperthyroidism. But the thing is, your hair's not supposed to grow that fast. So when your hair starts growing so fast, it's not strong anymore. It's really brittle and it breaks and it's thin and fine, and it's not like a nice healthy growth, because, and same thing with the skin, it's not a nice healthy growth because you're stimulating it just too fast, faster than it should be growing. So let's take a second to just kind of take this information, the effects of the thyroid hormones, and look at some symptoms that we would see with hyper and hypothyroidism. So let's start with hyperthyroidism. This is most commonly because of something called Graves' disease. And hyperthyroidism, do you think we have too much thyroid hormone or too little? Too much, right? So we have increased levels of the thyroid hormones. Interestingly enough, when we test for hyperthyroid and hypothyroid, we don't test for the levels of thyroid hormones in your blood. We actually test for how much TSH you have in your blood, how much thyroid stimulating hormone. And there is this opposite effect with them. So if you have too much thyroid hormone, if you have hyperthyroidism, your blood test would actually show a decrease in TSH, thyroid stimulating hormone. The reason behind that, remember you've got your pituitary. Your pituitary releases the thyroid stimulating hormone. That comes down to your thyroid and tells your thyroid to produce T3 and T4. If I have a ton of this, right, I have tons and tons and tons of T3, T4, that's going to tell the pituitary, stop, right? Stop stimulating me. I've got tons of this stuff already. We have way too much. Remember that negative feedback? So when you look in the blood, you'll actually see that there's very little TSH. The reason we measure that, we can measure thyroid hormones, but you have to measure free thyroid, and remember most of it's bound to these proteins. So it takes extra steps to measure it, and then measure the unbound concentration and correlate that to how much total concentration there is, and it's extra steps. So it's easier to just monitor the TSH. So hyperthyroidism. Graves' disease is the most common form. We see that there's increased thyroid hormones. That's like my new way of saying it. And we see a decreased TSH in a blood test. So what do you think about weight? Do you think these patients would have weight gain or weight loss? What is it? Good. Weight loss. Why? High metabolism. They are burning through everything you put in them. Give them nutrients and they just burn through them. There's no storing fats. There's no storing nutrients. Everything just gets burned through. So we see weight loss. What do you think as far as heart rate and blood pressure? What?
Rapid heart rate.
Okay, rapid heart rate. So increased heart rate. What about blood pressure? Increased blood pressure. And remember, it goes to the heart and stimulates the heart to contract harder and faster. What about sleeping? Do you think they'll be tired all the time or have insomnia? Insomnia. And insomnia because they're very, very stimulated. And then nervousness also. There's actually a really profound effect, like mental effect, with untreated hyperthyroidism and hypothyroidism. See a lot of anxiety and nervousness with hyperthyroidism, a lot. What about hair? Increased growth or decreased? Increased hair growth. Again, this is not a nice thing. You think weight loss, my hair's gonna grow, this is amazing. It's not in a good way. Let's see, weight loss, increased heart rate, increased blood pressure, insomnia, nervousness, hair growth, sweating. Sweating because of the heat generation. Okay, you're generating tons of extra heat, so you're hot all the time. So that's hyperthyroidism. Hypothyroidism. It's most commonly associated with something called Hashimoto's. And Hashimoto's is it's an autoimmune condition. So for some reason, your body starts attacking itself, right? Autoimmune is like self-immune. So you start attacking your thyroid gland. Attack your thyroid gland too much. Oh God, I didn't put goiter. Sorry. Oh, I didn't, no. Oh God, okay. Okay, so for hyperthyroidism, goiter is an enlarged thyroid. Okay, so you will see the thyroid gland protruding right here. You can normally palpate it first before it's super visible, but you will really see a large thyroid gland. And then protruding eyes. So you see like bulging eyes. Okay. Hypothyroidism. Again, Hashimoto's, which is an autoimmune condition, is the most common cause of hypothyroidism. Do you think thyroid hormones will be high or low? Decreased thyroid hormones. What about TSH? When we measure the blood, we're going to measure TSH concentration in the blood. Do you think it'll be high or low? High TSH. Okay, because remember, we're not making enough T3 and T4. There's not those in the bloodstream. So the pituitary is like, come on, what's going on, you guys? Like, this is not okay. We need more, we need more, we need more. So we start pumping out a bunch of TSH. Now the problem is that it's the thyroid gland that's messed up. So I can start releasing a bunch of TSH, that's fine, but I don't have enough thyroid follicles to actually make the thyroid hormone. Okay? So what do you think about weight with hypothyroidism? Would we have weight loss or weight gain? Weight gain. Because remember, the thyroid hormones stimulate your metabolism. So if you don't have enough thyroid hormone, you're not stimulating your metabolism. Your metabolism slows way down and you start just storing everything, just keeping all those nutrients in instead of burning them. So there's a lot of weight gain. What do you think as far as like, do you think you're like there's insomnia and all this energy and nervousness, or do you think that there's more of a slowdown, like lethargy? Lethargy, right? And instead of nervousness, we tend to see depression. But you can see that with either one, so I won't put that just for hypo. But you see lethargy, tired, sleepy, right? Because this is how you make thyroid hormones stimulate energy. You make energy. And if you're not making energy, you don't don't have energy. You don't feel like you've got the fuel to do things. We do see hair loss here as well. And that's just because you're not stimulating these cells at all. So the hair isn't growing like it's supposed to grow. What else? You see a goiter here. I know that seems kind of weird. Why would you have a goiter with both hyper or hypo? But you can. You can see a swollen thyroid gland with either hyper or hypo. Sometimes you'll see like decreased heart rate and blood pressure. Is that everything I wanted to put? Yeah. Okay, good. These are really common. You'll see these a lot in practice. Let's see. So when we look at the thyroid gland, we think of thyroid hormones. But the thyroid gland is also responsible for producing another hormone called calcitonin. Calcitonin should be somewhat familiar to you from when we did skeletal system. And when we talked about the bones and calcium homeostasis, we talked about calcitonin. So hopefully this is all review. When we look at the thyroid gland has thyroid follicles, right? We said that we've got these these follicle cavities and then the follicle cells around the outside. And those thyroid follicles are responsible for making T3 and T4. The thyroid gland also has C cells. Okay, they're separate, they're outside of the follicle. These C cells, they're called C cells for clear cells. They don't stain very well. The thyroid follicles stain beautifully, and then we have these C cells that don't stain as well, especially with old traditional methods of staining, so we call them clear cells. They're also called parafollicular because of where they are, right? They're like around the follicle. So you've got your follicle, and then outside of the follicle, you've got your C cells. The C cells produce calcitonin. And again, calcitonin helps to regulate calcium concentrations in the blood. Just thinking really quick about calcium. Remember, we've got like our bloodstream, right? And it's really important that we have the right amount of calcium in the bloodstream. That's important for muscle contraction. It's important for the way that neurons fire. Calcium concentration is very, very important. So we kind of have this way that we can store calcium in our bones so that we always have this like bank account of calcium. So if we have too much calcium in the blood, we don't want too much. That's really dangerous. So we'll just pack it into the bones for later. If we don't have enough calcium in the blood, we can take it out of the bones, right? We can withdraw from the bank. We can take the calcium out of the bones to always make sure we have the right amount of calcium in our bloodstream. Okay? We also work the kidneys and stuff, which we'll talk about. But remember, that's kind of the deal with calcium. So the hormone calcitonin is released from the thyroid gland when calcium concentrations rise. Okay, the way I remember that, calciton in here, right? Ton in here. There's a ton of calcium. So when you have way too much calcium in your fluids, mostly in your blood, right? So calcium rise in the blood. Don't confuse that. We're not talking about the bones. We're talking about the fluids. So too much calcium in the blood, the thyroid gland releases calcitonin. So then overall, calcitonin tries to decrease the amount of calcium that we have in our blood. Okay, so the net effect overall is to try and decrease serum calcium or blood calcium levels back down to normal. We do that in a couple ways. One, calcitonin goes to the bones and inhibits osteoclasts. Remember when we talked about the bones? We have osteocytes, we're not worried about them, but we have osteoclasts and osteoblasts. Blasts build bone, clasts chew it up. So if you think back to bone, remember you have like this collagen substructure, and then we pack it with all of these calcium crystals. I mean, hydroxyapatite, but all different types of like calcium phosphate, calcium hydroxide, lots of different stuff. But calcium is what we're worried about. So we pack the bones with calcium. Now, osteoclasts, we said, chew up bone. Osteoblasts build bone. So the osteoclasts would normally come in here and take away all of this substructure so that the calcium got released into the blood. we have too much calcium. We do not want any more. So we inhibit those osteoclasts. We turn them off so that they stop releasing calcium from the bone. They stop dissolving and chewing up the bone. At the same time that we inhibit those, we allow the blasts to keep working. Okay, so we stop degrading bone, and the blasts keep coming in and laying down the bone, so we keep taking more calcium from the blood and packing it into the bone tissue. Okay, so essentially, overall, what this does is it slows calcium release from the bone, okay, and allows us to pack calcium from the blood into the bone. The second place we can affect calcium concentrations is at the kidneys. So our kidneys filter out the blood, right? And whatever wastes that come out of the bloodstream, wastes and ions and stuff, that ends up going out of the body as urine. So when we look at the kidney, we'll see that there's this place in the kidney where we can kind of fine tune the urine. If we need ions, we can take it back. We can reabsorb it back into our body. If we have too much of something, we can excrete it into the urine to pee it out, right, to get rid of it. So we have too much calcium, right? If we have too much calcium, we want to pee it out. We can get rid of it in the urine. So calcitonin does that. Calcitonin goes to the kidneys, and it stimulates calcium excretion in the urine. Okay, so we start peeing out the calcium. And again, the overall point is we had too much calcium in the blood. We release calcitonin from the thyroid gland. This calcitonin works to decrease the calcium in the blood. We put it away into the bones, we urinate it out, we just try and get it out of the blood. So that's it for the thyroid gland. That brings us to the parathyroid glands. The parathyroid glands, we've got 4 of them. They're very, very small glands that sit on the back of the thyroid. So your thyroid, remember, is like this butterfly that wraps around the trachea. And then if you look at the back of it, so like on these back portions of the thyroid gland, you'll see 4 parathyroid glands. They're very, very small. Okay, altogether they weigh 1.6 grams. So 0.4 grams each. They're like a little grain of rice. They're tiny, tiny little glands. The parathyroid glands release parathyroid hormone. Don't mess that one up on the test. I don't know, sometimes people think I'm trying to trick you or something. I'm not. The parathyroid glands release parathyroid hormone, or we call it PTH. So this is produced by chief cells, and we release PTH in response to a decrease in calcium in the blood. So it's the opposite of calcitonin, right? When we have a ton of calcium, we release calcitonin. When we don't have enough calcium, when we have low calcium concentrations in the blood, we release parathyroid hormone from the parathyroid gland. So again, we say that this is an antagonist for calcitonin. What does antagonist mean? What?
Goes
Against, right? Like opposite. Like it has the opposite effects. It goes, like if someone's antagonizing you, right, they're going against you. So parathyroid hormone does pretty much the opposite as what calcitonin does. So its overall effect is to try and increase the amount of calcium in the bloodstream. And remember, we can do that in a couple ways. We can take calcium out of the bones. We can go to the kidneys and we can say, stop peeing it out. I don't have enough. I don't want to waste it. And then we'll also see that via another hormone, parathyroid hormone will work in the GI tract as well. So here, this is showing you again the posterior side or the back of the thyroid gland. So like the trachea or windpipe goes through like that. This big one is the thyroid gland. These tiny little ones on the back, those are the parathyroid glands. So again, like looking here, you see these itty bitty little dots on the back of the thyroid gland. Those are your parathyroids. Again, they release parathyroid hormone in order to control calcium concentrations in the blood. This is just showing you, so this is microscopically, this is all thyroid tissue. Okay, like if you look at it, you can see, right? See these follicles? right? You've got the follicle cells are on the outside, the cavity in the middle. This is the capsule that surrounds the parathyroid gland, and then all of this in here is the parathyroid gland. Okay, so this is the thyroid, this is the parathyroid. Again, when we look at the parathyroid gland, we see cells that are called chief cells, and those chief cells are going to make PTH, or parathyroid hormone. So, overall, what's the point of PTH? What does it do overall for calcium? Increases calcium in the what? In the blood. So if you know that, you can reason for everything else. Like literally, I will not give you an option on the test that like makes sense, but it's wrong. You know, I'm not gonna say like, okay, increase calcium in the blood. I'm not gonna say like some sort of an effect somewhere that would like increase taste receptor sensitivity to calcium. Because like, oh, well that would make sense, right? We want more calcium. No, just if you know that overall it's supposed to increase calcium in the blood and you can reason through the rest of this, then you should be okay. Same thing for calcitonin. So let's look at these. Let's see if they make sense. Stimulates osteoclasts and inhibits osteoblasts. So again, osteo, we're looking at the bones. What do osteoclasts do? Clasts chew, right? They chew up bone. What do osteoblasts do? Build bone. So we stimulate the clasts. So remember, I've got all of this substructure and I pack it with calcium. If I stimulate my clasts, I start chewing up this bone, right? I get rid of all of that collagen, and then this calcium gets released and goes into the blood. It's good, right? I chew up the bone, I release the calcium, now I have it in my bloodstream. That makes sense, because I want to increase the amount of calcium in the blood. Inhibiting the blasts makes sense. Remember, the blasts are going to do the opposite. They're going to build the bone. So they're going to pack all this in, and all the calcium is going to start going into the bones. We don't want that, because it's going to decrease the amount of blood. Right? So inhibiting the blasts makes sense. Overall, that releases calcium from the bones. It also enhances the reabsorption of calcium at the kidneys, so we don't lose calcium in the urine. Again, the calcium will get filtered out of the blood into the urine because that's just based on size. It's small, so it'll get filtered out and pushed into the urine. But we don't want to pee it away. Right? We need it, we don't have enough. So we reabsorb it. We'll actually pump it, actively pump it back into the body so that we can keep it and we don't urinate it out. Again, that makes sense, right? I need more calcium. It makes sense that I would want to reabsorb it so that I don't urinate it out. The third thing that parathyroid hormone does is it stimulates the release of calcitriol from the kidneys. Calcitriol is another hormone. We've talked about it before because it comes from vitamin D3. Remember, vitamin D synthesis in the skin ends up leading to the formation of this calcitriol in the kidneys. So what calcitriol does is calcitriol works in the digestive tract, and it enhances or increases the absorption of calcium from the GI tract. Remember we said vitamin D3 is important for calcium absorption? That's why when you go to the drugstore and you buy calcium, it's calcium plus D, because you need enough vitamin D3 to absorb enough calcium. So, and this makes sense, right? This complements PTH. We want more calcium, so it makes sense that we would want to absorb more of it from our GI tract. The way I remember this is tri is 3, right? And PTH has 3 letters in it. So calcitonin is when you have a ton of calcium. PTH is the other one. PTH has 3 letters, so it goes with calcitriol. That way you don't try and put calcitriol and calcitonin together. They don't go together. Okay? And that's like 10 steps down the road, but it fits up here.